Hey everyone, this is Dr. Sebastian Gonzalez with Performance Play Sports Care. Today we're going through FAI or Femoral Acetabular Impingement of the hip or labral tears of the hip and things you should probably know about them. This is an ongoing series. It's going to go through about 7 podcasts. And just so you know, in case you don't want to hear my voice at all, there is an article I put on this on my site on p2sportscare.com, which you can check it out. I have all the references I'm talking about on there, and hopefully I wrote it very concisely. If you have any spelling errors you find, feel free to shoot them over to me. I'm not great at proofreading, but I do like to get content out. So this one is on the 3rd section of the article, and is on. I made it so it said correction of a quote-unquote broken joint or muscle does not correct all the problems with FAI of the hip. And what this generally means is if you fix something structurally, and actually I should backtrack on that. One of the issues with FAI, the hip or labral tears, is that there's sometimes cam deformities, we call them, or there's oblong-shaped presentations of the femoral head or the ball that goes into the socket of the hip. And this actually happens on guys, especially guys that are younger in their adolescence, more active in their adolescence. They have these oblong-shaped femoral heads, and a lot of times it'll create havoc or wreak havoc on the cartilage of the hip. So this one's actually a very interesting article I went through. This was from 2013. It was titled The Effects of Cam Femoral Acetabular Impingement Corrective Surgery on Lower Extremity Gait Biomechanics. And this one just screams to me that I know that a lot of people feel that if they have something corrected surgically, it should be good from there. And that's not the case a lot of the times. I've used the analogy before with a lot of people coming through my clinic. Then I start punching the wall, and I say, hey, if I punch this wall, this drywall, enough, what's going to happen? And they're like, well, you're going to break a hole in the drywall. I'm like, okay, so I can plaster that hole up, and the hole will be gone, and what if I keep punching it? They're like, you're getting another hole. So that is basically this analogy, and although you fix something surgically, it doesn't substitute the need for corrective exercise, deep tissue work, neuromuscular re-education, we call it. So basically working with someone to correct the thing that started this in the first place if it wasn't trauma. And this is going to take a lot of work, a lot of motivation. I had a patient that came in actually last week who said, and he was playing devil's advocate, but he was saying, I know why a lot of people don't understand. So he had I'll tell you actually what he had. He had a rotator cuff tear. The subscapularis came off. They had to reattach it. It was from a fall. And he's kind of like joking around, but he's saying like, why does rehab have to take 6 months? And I'm like, yeah, you ripped it off. They had to put it back on and anchor it back on. He's like, I know, but he's like, I didn't understand this until someone actually told me. And so for all the things that he'd had in the past, he did not understand why it took so long to correct, or why he had to go to quote-unquote rehab or therapy so long. And this study is actually a good way of kind of seeing this from a hip standpoint. So what they found actually in the study, and I'll flip over to it on my computer, is so the results showed that gait biomechanics of the patients did not return to normal after the surgery. Post-operative patients, or ones that had the surgical repair, had some reduced range of motion. They had reduced power compared to the control group, but they did have reductions of pain. It did say so. Pain again is a great thing that we at least can get people into the clinics with, but it's not a good gauge for total functionality because it says in here again, the results of the study or of the surgeries did not return people to normal gait mechanics. If you don't know what gait is, it is the way you move in walking phase, in running. So if these are altered, a lot of the forces from the ground will shoot up and end up hitting spots that You don't want them to hit. I like to describe muscles as the buffer for the energy absorbed through gait and landing and jumping and so on. So, and if you've taken a physics class, you'll understand this a little bit better. But I believe it was one of Newton's laws. I don't remember which one, but it was energy can't be created or destroyed. So it always transfers between things. And the analogy I typically give at work is I have this old pogo stick, and I jump on it a little bit, and I show them how the energy from me jumping on it is absorbed in the spring, and it shoots it back out. And that's what saves the joints. The muscles and tendons absorb a lot of that energy from impact, especially from walking and running. Running has higher amounts of energy transferring through the lower extremity of the limbs than walking does, and jumping is probably higher than running. But either way, you see that with this study from 2013 that it does not eliminate, just because you have a surgery, it does not eliminate the need for re-educating your body how to function. The muscles, tendons, ligaments all have to be saved in here, and a lot of times it takes really consistent rehab. And you might say, well, you might ask, where do I go to? You don't have to go to physical therapists. You have physiotherapists, physical therapists, sports chiropractors. Even a great personal trainer or strength coach can show you a lot of these things. We have to make sure you home it in and have the correct diagnosis, but at the same time, if someone knows how to show a squat or a plank, I mean, they know how to show a squat or a plank. It doesn't have to be, they don't have to have a higher degree or a professional degree to show that. So anyways, this is something that typically people have to do about 2 to 3 days a week. They have to do some rehab. They have to establish some consistency and have some accountability with it. Because I can tell you, at least from my side and being in the clinic, the people that don't respond well are the ones that don't take the rehab seriously. They do not do things at home. They don't come into the clinic. They might not have time. And that's okay if they don't have time to come here or come anywhere else, but they have to do it at home. If you want your body to repair, if you want your gait to improve, if you want your muscles and tendons to work well to save that joint, to save your FAI, your cartilage, your hip, and so on, then you need to work at it. So correcting the labrum and the impingement is not the end-all answer when you do it surgically. So I hope this was helpful to everybody. Again, we're going to go through more parts of this. We have all the way through 7. I'm hoping we do 7. Some of these topics are a little bit more complex for consumers, so I'll try to make them very, very easy. But all along the way, feel free to learn about anatomy and learn about mechanics of the hip, the lower extremity, the knee, the ankle. I've always wondered how the body functions, or at least as long as I can remember in school. I think it's interesting, and it's interesting to me from a mechanical standpoint and how to correct things. But I think everybody, if you have a body, if you have a car, learn how it works. Like if you have a body, learn how that works too. It's your responsibility to learn how to feed yourself, learn how to take care of your body, learn how to exercise, and so on. So learning anatomy, mechanics, and relative diagnosis around an area are going to be important if you're going to have good health care, if you're going to have a good conversation with your treating physician, with your strength coach, whoever it might be. It's important. Education, or at least people that I've experienced in my office or throughout my professional career so far, who have had good educations or good know-how of where to find, or at least know a little bit of anatomy, I can guide them so much better, and it's not so much hands-on and coming in and seeing me in frequency, because that's not what I think the public wants. So I hope this was helpful. Find us on Twitter and Instagram @PerformanceHB, and talk to you guys soon.